Hang the solution bag in the center of the hood. Disinfect the injection port with an alcohol swab and let it dry. Discard the swab on the side of the hood with the non-sharp waste. Push on the plunger to expel air from the syringe. Remove the needle guard. Lift the end of the bag, taking care not to contaminate the injection port or to disrupt the laminar airflow with your hands. Holding the barrel of the syringe from underneath, slowly insert the needle into the injection port at a 90-degree angle, making sure the needle does not pierce the sides. Pull back on the plunger end plate to draw in fluid until the desired volume is obtained. Work at a 70-degree angle throughout this operation. Return the syringe to a vertical position and clear any air bubbles, tapping with your fingers to free the bubbles from the rubber of the plunger. Expel the air by pushing on the plunger. Before removing the needle, adjust to the required volume. To do so, line up the outside edge of the plunger, the part in contact with the fluid, with the graduation indicating the desired volume. Bring the syringe back to a 70-degree position and withdraw the needle. Cap the needle and perform verifications as required by facility protocols. First, make sure all the powder has been dislodged from the walls of the vials and then disinfect each vial, wiping in the direction of the opening of the hood. Handle only the surface of the swab that does not touch the site to be disinfected, taking care that there are no threads on the surface of the swab. Let the alcohol dry and remove the needle guard. Holding the syringe from underneath, insert the needle at a 45-degree angle into the circle in the center of the stopper, bevel side up. Rapidly bring the syringe to 90 degrees. Tilt the syringe vial assembly to 30 degrees and slowly inject a small amount of fluid into the vial. Allow a little air to return into the syringe as soon as resistance is felt. Alternate between these two steps until all of the diluent has been injected. Equalize the pressure in the vial by drawing in a volume of air at least equivalent to the volume of fluid injected. Place the vial on the work surface and remove the needle. To prevent a needle stick, recap the needle slowly, your wrists pressed against each other. Take care not to contaminate the needle. Set the syringe aside. If there is any liquid on the vial stopper, wipe it with an alcohol swab. Shake the vial, if the medication permits, with a gentle circular motion. Wait until the product is completely dissolved and the foam has disappeared before withdrawing from the vial. Disinfect the rubber stopper of the vial and let it dry. Hold the syringe at a 70-degree angle and draw in a volume of air equivalent to the amount of solution to be withdrawn. Remove the needle guard. Insert the needle at a 45-degree angle and rapidly bring the syringe up to a 90-degree angle. With the palm of your hand facing upward, slide your index and middle finger on either side of the neck of the vial. Invert the syringe vial assembly to a 70-degree angle and inject a little air. This creates positive pressure that pushes the fluid into the syringe when the plunger is released. Draw a little fluid into the syringe by pulling on the plunger end plate. Raise the vial gradually to ensure that the bevel of the needle remains in the solution. Repeat these operations until the entire desired volume has been withdrawn. Expel the air from the syringe by using one large bubble to capture all the smaller bubbles. Then tap the syringe barrel to free the bubble from the rubber plunger. If necessary, draw a little air from the vial to create a bubble. Adjust the volume in the syringe to the desired level. If necessary, return air from the syringe into the vial. Place the vial on the work surface. Remove and recap the needle. Check the volume and quality of the finished product. Place the syringe beside the vial for further verifications. Attach a filter needle to a syringe. Holding the ampoule vertically, tap it gently to release solution trapped in the tip of the ampoule. Disinfect the neck of the ampoule and allow it to dry. Hold the body of the ampoule firmly in one hand and the tip of the ampoule between the thumb and index finger of the other hand. With a rapid snapping movement, break the ampoule towards the side of the hood. Place the ampoule on the work surface away from the manipulation area, taking care not to disrupt the laminar airflow over its opening. Discard the tip of the ampoule in the sharps container. Remove the needle guard. Take the ampoule between your index and middle fingers, palm facing upward. Hold the syringe from underneath in your other hand. Tilt the ampoule and gently insert the needle, taking care not to contaminate it. Place the free fingers of the hand holding the ampoule on the syringe without disrupting the laminar airflow over the opening of the ampoule and the needle. Draw in fluid, gradually tilting the assembly and keeping the bevel of the needle in the shoulder of the ampoule until the desired volume has been withdrawn or the ampoule is empty. Remove the needle from the ampoule. Put the ampoule down, placing it outside the manipulation area. Recap the needle and expel the air from the syringe. Check the volume and adjust it if necessary by returning excess fluid to the ampoule or onto a sterile gauze. Hold the syringe vertically and pull on the plunger to draw in fluid from the filter needle. Replace the filter needle with an appropriate injection type needle. Holding the syringe vertically, push gently on the plunger to fill the needle with fluid. Check the volume and the clarity of the fluid withdrawn. Perform verifications as required by facility protocols. The solution in the syringe can be served as is with a needle or a sterile cap. It can also be diluted into a larger volume for administration as a short or continuous infusion. We will look now at the final procedures in preparing ready-to-use injectable medications. Remove the wrapping from a sterile cap. If the syringe is served with a cap but the drug is to be administered with a needle, hold the syringe vertically and pull on the plunger until the fluid level is at the halfway mark on the connector of the syringe. Remove the needle. Place a sterile cap on the syringe, taking care not to disrupt the laminar airflow over the other exposed caps. Place the bag on the work surface so that the injection port is exposed to the laminar airflow at all times. Disinfect the port and let it dry. Remove the needle guard from the syringe filled with solution. Gently insert the needle into the injection port at a 90-degree angle, taking care that it does not pierce the sides. Slowly inject the fluid. Remove the needle and recap it. Put the syringe aside. Gently disperse the fluid in the solution. Inspect the solution after each addition for particles or precipitates. Proceed in the same manner to inject other medications in the bag. Disinfect the injection port before each addition and after the last one. When all additions have been made, invert the bag several times to ensure thorough mixing. Inspect the final preparation in accordance with facility protocols. Disinfect the rubber stopper and let it dry. Insert the needle in the center of the stopper at a 45-degree angle, bevel facing upward, and quickly bring the syringe up to a 90-degree angle. Allow the syringe to empty completely before withdrawing it. Proceed in the same way to inject the other medications. Disinfect the stopper before each addition and after the last one.